today in prostate cancer, we absolutely have 0 predictive biomarkers. Work from our my laboratory colleagues suggested that the presence of ETS gene fusions could be a potential predictive biomarker. It's something that happens early in the stage of the disease. There is data that would suggest it's a driver to cancer development and so on, and potentially it will have an impact potentially on maybe not so much biology necessarily, but definitely in terms of response to treatment. And so, and work from other collaborators, and again from our group, gives a feeling that, again, targeting AR from one angle may not be enough, and therefore multi-targeting would be a good idea. And the data that we have, that the multi-targeting, particularly in the ETS gene fusion, might give you the biggest bang in terms of anti-tumor effect. So consequently, we actually developed a phase 2 randomized trial. It's the first biomarker based trial in this disease. Thus far, we have, this is a trial that's being conducted in about 12 centers with real tissue biopsies from metastatic patients, where the tissue is evaluated centrally at Michigan with, to assess for the ETS status. And then patients are then stratified if they're ETS positive or negative, and then randomized to abiraterone versus abiraterone and a PARP inhibitor, ABT888, which is a PARP inhibitor that the NCI provides. We're actually thrilled that we are able to perform this trial. We have, before I came, actually registered our 125th patients. Over 100 patients have been now randomized. The yield on the biopsy has been really quite rewarding, because that was one of the issues with bone biopsies. You would be concerned about the yield. We've had somewhat about, as you'll see in the poster, 75% biopsy yield in the bone, and 100% practically 100% in the soft tissue disease. So from an accrual perspective, I think we're really on time. And as I said, I think the way I view this trial is a pioneer trial, because again, it's going to open up the door, I'm hoping, to actually more development of biomarker-based trials, therapeutic trials for patients, and combination therapy development.